This is Ready Steady Po with me Sindhu, and hey, if you're wondering where I am right now, I am at G Prabhakaran. We're at the Raghavan Colony 3rd Street. We're here to meet all these sanitation workers. Over 30 to 50 of them are here right now clearing up all the garbage pile up that has accumulated in Chennai. Over 1 lakh tons of garbage has piled up in the city, and these guys are working tirelessly, working day and night, trying to clean the city out. So we thought from our end, the least we could do is actually protect them from the infectious diseases that are doing rounds, try to really give them prophylactic dosages. And Fortis Hospital has been kind enough to give us the supplies, and we have two affluent doctors with us, Dr. Vijay and Dr. Aarti from Fortis. We are going to start off our camp right now, and we are going to vaccinate all of these people. We are going to give them TT shots, that is tetanus shots, and also give them a dose of doxycycline that will help prevent leptospirosis, which is also known as rat fever. So I'm really excited to be here. I'm so excited to meet all these people who are going to make Chennai city cleaner. So let's all hear a big shout out for these guys. Yeah, fantastic. You're doing a fabulous job.
It's most unfortunate that citizens of Madras have faced this natural disaster, and at least 40 to 50% of these people who have been affected are children. Children are affected in many different ways. One is the physical ailment, and second is the emotional and stress they are facing, as they have never faced this kind of a fearful situation. Coming to the water and foodborne infections, gastroenteritis is very, very common, and diseases like typhoid, cholera and jaundice and amoebic infections, other parasitic infections like giardiasis, all this can happen because of the water contamination. So the sumps must be taken care and cleaned up, and clean water must be provided to children. Airborne infections like flu, cold, cough, and because of the stagnation of the water, there are a lot of breeding in the mosquitoes, and we must be prepared to meet the problems like dengue and malaria and so on. Contaminated water can also result in some of the rickettsial diseases like rat bite fever. We must take actions to prevent all this also. Injury can again result in skin infections which can spread all over the body. Now, how do you prevent all this? Prevention is very important. Now, health education is very important. Now, you must educate the parents at different levels. One is at the family level, school level, and subsequently the professional doctors can also help in educating the parents about clean air, clean water, clean food to be given, so that all the waterborne, foodborne infections can be reduced. Then prevention of mosquito bites to the maximum extent possible. Prevent mosquito bites by keeping the windows closed and using mosquito repellents, and avoid stagnation of water everywhere inside the house or outside the house, which will result in breeding of the mosquitoes. And whenever there is an injury, see that the wound is cleaned with soap and water, and if necessary clean it with some antiseptic lotions like Dettol. Plus all the possible vaccinations, whatever is available, must be given to the children population, like typhoid vaccine, cholera vaccine and hepatitis vaccine and the flu vaccine. All this must be administered. Now, the other side of the coin we must all realize is what an amount of trauma, fear the children have gone through seeing the floods, especially the older children. They are facing a stressful situation now because 1 month the school is closed and they are lagging behind in the studies. When they get back to school, they have to catch up with the studies. Now, during the catch up process, too much of workload is put on them, and this too much of workload can result in tension, not only physical tension, it's emotional tension, and that should be taken care of. How do we take care of this tension? Try to counsel the children, and at the family level, at the school level, and if necessary, the children who are really been upset because of the floods out of the fear complex must be taken to proper counseling sessions. Please protect the children from these communicable diseases and provide them emotional support. Thank you.
The entire city is recovering from the aftermath of the unprecedented floods which we had, and there is a fear among the public regarding the various epidemics which may start, especially regarding the health issues. This is understandable. There may not be a major diarrheal disorders like cholera and all that. Most of the diarrheas which we are getting are all simple vomiting and diarrhea which lasted for 2 or 3 days. But the major ones which can happen will be conditions like typhoid, leptospirosis, jaundice, etc. Typhoid is should be foremost in our mind. If you are not vaccinated in the last 3 years, it is worthwhile getting vaccinated now. If you are careful with food and water, very unlikely you will end up with typhoid. So is jaundice. Hepatitis A or E, especially the E, comes in this monsoon, after the monsoon. The same measures which we take for typhoid, like taking, being careful with food and water at home, will reduce the risk of developing these two. There is a general fear in general public mind regarding leptospirosis. It is variously called as rat fever and nothing, though exactly it's not a rat fever. When we walk through flooded roads, we get exposed to the thing. You are more vulnerable if you have any wound or scratches in your leg. So that's how the bacteria enters into your system. All leptospirosis are not fatal, but several of them can be fatal. Mainly it starts like any other infection with high fever and thing. Certain people, about 10 to 20% of the people develop serious forms of the disease where liver and spleen get involved. They get severe jaundice, they go in for progressive renal failure, and they may even die in spite of intensive treatment. Otherwise, most of the people, about 80% of the people, recover well with good medications, with prompt diagnosis and safe treatment. So leptospirosis is not it is a significant disease, but not all that a deadly disease. So people should be careful when about these three major conditions, because these are the ones which require hospitalization. If any time you suspect any of this, or you go to your nearest doctor and go to your hospital and have yourself checked and treated. Generally in Chennai, we have a flare up of seasonal infections like colds and cough, asthmatic getting flare up of their asthma attacks during this seasons. There may be a bigger flare up of this respiratory and other ailments which happen during this season. So one should be aware of that. Asthmatics should be careful, should have their regular medications and take precautions to prevent acute attacks.